The tedi goat is one of the most popular and well-known breeds in Pakistan. It is primarily found in the Punjab region, especially in areas like Faisalabad, Sargodha, Jang, and Toba Tek Singh. Apart from Punjab, it is also raised in parts of Khyber Pakhtunkhwa, Baluchistan, and Sindh. The tedi goat has a small body, medium weight, and a well-proportioned attractive appearance, which makes it suitable for both domestic and commercial farming. In terms of color, it is mostly white, but some tedi goats can also be found in black, brown, or spotted patterns. However, white is the most common and preferred color. A tedi goat can give birth twice a year, typically producing 1 to 3 kids at a time, with twins being the most common. With good care, balanced nutrition, and proper health management, their breeding rate is very productive. When it comes to milk production, the tedi goat is considered an average milk-producing breed. On average, it produces about 1 to 2 liters of milk per day, but with excellent care and feeding, some can produce up to 2.5 liters daily. The milk is rich in nutrients, thick, and flavorful, making it especially beneficial for children and patients. One of the major advantages of the tedi goat is that it can be raised in small spaces with limited resources. It matures quickly and becomes ready for breeding in a short time, making it a highly profitable option for commercial goat farming. Tedi goats are prone to several diseases that can severely affect their health and productivity if not treated timely. One common disease is enterotoxemia, pulpy kidney, caused by sudden changes in diet or overeating. Symptoms include sudden death, abdominal bloating, teeth grinding, and unconsciousness. Treatment includes administering penicillin and using enterotoxemia toxoid vaccine for prevention starting from 3 months of age. Avoid sudden changes in feed. Another issue is foot rot, which occurs due to standing on wet or dirty floors. Symptoms are swelling, lameness, and foul-smelling discharge from the hooves. Treatment includes foot baths using copper sulfate or zinc sulfate and injections of tetracycline or penicillin. PPR, Peste des Petits Ruminants, is a viral disease showing signs like fever, discharge from eyes and nose, mouth ulcers, diarrhea, and coughing. There is no cure, but prevention is possible through the PPR vaccine. Supportive care includes antibiotics for secondary infections and oral rehydration solutions. Pneumonia is caused by cold weather or poor ventilation and presence with fever, nasal discharge, coughing, and labored breathing. Treatment includes oxytetracycline, enrofloxacin, or penicillin streptomycin injections. Warm, dry housing and plenty of water help recovery. Mange or scabies is a skin disease caused by mites. Symptoms include severe itching, hair loss, and scab formation. Treatment includes ivermectin injections or topical use of permethrin lotion, and strict hygiene should be maintained. Coccidiosis affects the intestines, mostly in kids. Symptoms include bloody diarrhea, weakness, and poor weight gain. Treatment involves sulfa drugs like sulfatamidine or improlium. Clean water and feed hygiene are essential. Worm infestation causes poor digestion, weight loss, and weakness. Treat with deworming medicines like albendazole, levamisole, or ivermectin every 3 months. Regular deworming and clean environment are key for prevention. Abscesses or lumps may form anywhere on the body due to bacterial infection. Treatment involves lancing the abscess to drain pus, cleaning the wound with povidone iodine or hydrogen peroxide, and administering penicillin. Mastitis, an inflammation of the udder, is common in lactating goats. Symptoms include swollen udder, bloody or reduced milk. Treatment includes warm compresses, mastitis tubes, and injections of tylosin or ceftiofur. Myiasis, maggot infestation, occurs when flies lay eggs in wounds. The maggots must be removed, and the wound cleaned and treated with negasin powder or ivermectin. Maintaining cleanliness and regular health checkups are essential for disease prevention. Prompt identification and treatment of diseases, routine vaccinations, proper hygiene, balanced nutrition, and good housing conditions are necessary to ensure the health and profitability of tedi goats. In severe cases, always consult a qualified veterinary doctor immediately. Starting a tedi goat farming business in the UK. Starting a tedi goat farm can be a profitable business, especially when managed scientifically. For a small-scale setup with 10 female goats and 1 male goat, you would need a space of approximately 600 to 800 square feet for housing and an additional 100 to 150 square feet per goat as open exercise area. This ensures the animals remain healthy and active. The initial investment for such a setup includes purchasing 10 female goats at approximately 100 pounds each and 1 male goat for around 125 pounds, totaling about 1,125 pounds. Constructing a simple but effective shed and fencing may cost between 400 pounds and 600 pounds. Feed for 2 months, including green fodder and dry feed, may cost about 120 pounds to 160 pounds. Vaccinations and medicines should be budgeted at 40 pounds, and water and feeding equipment at another 40 pounds. This brings the total initial investment to approximately 1,725 pounds to 1,965 pounds. Teddy goat kids must be fed only colostrum, the mother's first milk, for the first 3 days. After that, milk should be fed 3 times daily. Each kid consumes about 250 to 300 ml of milk per day. From 45 days onward, kids can be gradually shifted to dry feed and green fodder. Female goats are generally preferred for farming, as they can give birth twice a year, with an average of 1 to 2 kids per birth. They also produce milk, which though limited, is sufficient for the offspring. Male goats are mainly raised for meat and can bring profit during events like Eid, but maintaining only males is generally less profitable. Assuming each of the 10 females gives birth twice a year with an average of 1.5 kids per birth, the farm would produce about 30 kids annually. These kids can be sold after 3 to 4 months at an average price of 45 pounds to 65 pounds each, generating around 1,800 pounds in revenue annually. Annual expenses, including feed, vaccinations, and basic labor or upkeep, may total around 320 pounds to 400 pounds. This results in a net profit of approximately 1,400 pounds to 1,480 pounds per year on a small-scale farm. Scaling the operation can further increase profitability. To ensure optimal results, daily cleaning and maintaining a dry and cool environment is crucial. Vaccination schedules for diseases like PPR, ET, and FMD must be strictly followed. A healthy diet consisting of alfalfa, berseem, millet, and maize should be provided. After birth, kids should consume only their mother's milk for at least 2 months. If you'd like, I can also prepare an Excel sheet or a printable business plan with monthly cost analysis, breeding timeline, vaccination calendar, and projected income. Let me know if you want that.